According to a Department of Health and Human Services report of July 2002, a shortage of approximately 6%, or 110,000 registered nurses, existed in the United States in the year 2000. Based upon trends in the supply of RNs, coupled with anticipated demand from the aging baby boomers, the shortage will be at 12%, or 275,000 nurses by 2010. But by 2015, the nursing shortage in America is projected at approximately 500,000 nurses. In 2000, 30 states were estimated to have nursing shortages. By 2020, the shortage will impact 44 states and the District of Columbia. The time to act is now.
What is this nursing shortage and how bad is it really? These are two of the questions we asked ourselves as news of the nursing shortage spread throughout the nation. We decided to go into the field and speak to the stakeholders, including the nurses themselves, nurses with 4 months to 40 years of experience. I'm the producer of this show, and I'm a registered nurse. I wanted to give the nurses and those who support them in their day-to-day work a chance to tell their own story.
Today, we'll have the rare opportunity to follow a nurse through her 12-hour hospital shift and speak to her as well as to her colleagues. We'll hear from the deans of schools of nursing and nursing researchers, as well as physicians, hospitals, nurses, and their organizations. And we'll hear from you, the public, and get your take on the nursing shortage. We're going to explore the shortage itself, its size and shape, and its sometimes life-threatening impact on each of us. We'll search out reasons we are so short of nurses and why the shortage is getting worse. We'll try to shed some light on possible solutions and the incredibly important question, who must act to end the nursing shortage? Thank you for joining us. I think you'll be surprised at some of the things you hear and see. We have the privilege in following a staff nurse around during her 12-hour shift at the hospital. We want to get to know her and get a glimpse of her day, where patient care is actually given. We want to understand what it's like to walk a very long day in her shoes, and at the end of that day, find out how she really feels about being a nurse. It is 6:45 a.m., 6 West Nursing Station. Change of shift from the night shift to the day shift. The nurses are in report, an important communication time, when critical patient information passes from one nurse to another, so patient care is uninterrupted. Let's meet Catherine Altroyd, RN, staff nurse, telemetry unit, and our guide for the day.
My name is Catherine Altroyd. I've been a nurse here. I'm an RN. I've been an RN for 2 years. Okay, and this morning I'm going in now. I just came in for work, so I'm going to collect my assignment, see what I'm assigned, what patients, what room number I'm assigned to. Then I will go around, check the patients, and then get the report from the nurses, and then we go from there. Hi. How are you? Potassium. They're getting potassium, so usually some of the medications you want to also check the labs before you give it. So this is the patient's potassium, so I have to check the patient's lab initially before I give the potassium. Then I'm going now to get my report with the nurses. Okay, we also have written reports. Let me see what this patient is calling. Okay, let me check, okay? Let me check with your nurse and see what you can get. Okay. Okay. I'm going back. I'm going to do my ACU check on 2 of my patients. I have 5 assignments today, which we're lucky. Usually we can go up to more than that. I mean, because of their heart condition, and they also have diabetes, or they have some medication that require that you monitor their blood sugar. And this is our ACU check machine where you go in and you program the whole thing, put to your paper. Okay, I'm going to draw up some insulin for my medications and pick up their medications as well. Okay, and things with insulin, blood sugar, because sometimes it's a strong medication, you might give a patient overdose, so you have to really double check it with another nurse when you draw it up. And then I find another RN to check it with me and be sure. Okay? Regina, check it. Check insulin. Sure. Okay. Patients get insulin. I check 264, so I'm doing it 5 minutes. regular. Okay, thank you. Okay. Because I would have preferred sometimes to take the medication with you, but because her food is here and I know she wants to eat, so I give her her insulin because she starts eating. How are you? Okay. I brought your insulin with me, okay? Your blood sugar was 264, so I need to give you a insulin before you start eating, okay? Monitoring the patients, their heart rhythm. And then usually you come over here all the time and you check, or you can ask the monitor to take this is dinner. Okay, and you can say hello. Hi. And you can ask her, what the rhythms are. You pick up, you record it as you go along. Okay.
We have obtained numbers and projections on the nursing shortage in America. So we met with the researchers, the professors, the hospitals, and the nurses themselves to find out just what those numbers mean. We asked the question, what is this nursing shortage? And how big or serious is it?
I have not really heard of the nursing shortage. I think up in Portland, I have heard a little bit that they don't have as many nurses because they're not as well paid as the doctors are, but that's all I know about it.
Okay, and what about you?
I haven't. I have not heard about it.
I haven't heard anything about it yet, no.
Okay.
Me neither. I'm not familiar with it.
Yes, we have a good friend who is a nurse, and we are aware of the shortage.